Hello, everyone. Um, Hopefully everybody can hear me okay. Want to say thank you so much for joining us today and a really warm welcome to our Partnering for Vaccine Equity learning community members and others working on vaccine equity. Really excited for this afternoon's event. My name is Leandra Lacey, and on behalf of our team at the Urban Institute, thank you for joining us today. Today will be an interactive conversation led by 3 learning community members to discuss organizational strategies in addressing COVID fatigue. We know that this is a really common issue across the learning community for both your staff within your organization and for the community members that you serve, especially since we're in a time when the sense of urgency around COVID has diminished. So today I'll have questions for our panelists, but I'll also pose questions to you all in the audience. And we encourage everyone to engage with questions and share the experiences, share your experiences and innovative solutions that you've used to address COVID fatigue. And before we go further, I'll do a typical quick review of how this session will work. There are quite a few of us here, so staying on mute unless you're speaking is key to keeping the discussion going without accidental interruptions. You do have the opportunity to speak your question rather than type it. Excuse me, speak your question rather than type it into the chat. It's really up to you. If you want to speak your question, we encourage you to use the raise hand feature on Zoom. If you want to type your question, you can use the chat to do that, and you can ask a question at any point during this conversation. We encourage you to chat amongst yourself as you like, but please use good chat room etiquette as well. We know this probably goes without saying, but please be civil to one another and to our panelists while chatting. We have live interpretation from English to Spanish today. And if you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. Finally, as with all of our learning events, we will post a recording of this event on our community website, and it'll be circulated through the digests that go out through the CDC-managed Adult Vax Program listserv, which all program members should be a part of. If you have any technical difficulties at any time during the session, you can send an email to our community manager's inbox at vaxequitylearning@urban.org. We'll be watching that inbox and we'll try to help you as quickly as we can. So without further ado, it's my pleasure to introduce our great panelists today. We have Wally Ramirez from OLA of Eastern Long Island in New York State. We also have Mariana Savela and Francisco Guerrero from the Hmong American Center in Wisconsin. And we also have Chanda Freeman from the Tennessee Justice Center. So to kick things off today, I'll hand it over to our panelists to tell us a little bit more about themselves, as well as their organization, including the populations that they serve, and a brief overview of their vaccine equity activities before we dive deeper into their strategies for addressing COVID fatigue. So how about we have Mariana and Francisco? Would you like to go first for your intro?
Yes, thank you. Can you guys hear me well?
Sounds good to me.
Perfect. Hi, everyone. My name is Mariana Savela, and I work for the unit of the University of Wisconsin in Stevens Point here in Wisconsin. And we work with a project. It's called the H2N project. The H2N stands for Hmong and Hispanic communities, the communication network. And our focus is on those 2 specific communities, but we also have a twin project. It's called the R2N, and that's focused on Caucasian population who live in rural areas. So thank you for having me here today, and we will be talking about this COVID fatigue 19 and how we have worked and addressed these issues within our team members and within the community that we serve.
Like Mariana was doing the introduction, I belong to the same organization, the University of Wisconsin-Stevens Point. We work for a department that is called Wisconsin Institute for Public Policy and Service. We have multiple projects that are providing outreach to the Hmong and Hispanic community here in central Wisconsin, which is a very rural area. We also partner with Governing Wisconsin to provide assistant with health navigation for health insurance. So we have a very good understanding of Medicaid at the marketplace, and that also can help us to provide a better outreach to the communities that we serve. Thank you.
Thank you so much. Chanda, would you like to go next?
Sure. Good afternoon. I'm Chanda Freeman, the Health Policy and Advocacy Manager for the Tennessee Justice Center. We are located in Nashville, Tennessee. So TJC is a 28-year-old nonprofit organization. We are a law firm / public advocacy group that is focused on making sure that people have access to public benefits and services. So on our team, one of our primary goals is advocating to expand healthcare coverage for the most marginalized folks. We also advocate for Tennesseans to have access to nutritious foods. The big part of our work also includes vaccine equity and connecting people to services and resources across the state. We serve people across the lifespan, from moms who need assistance during their pregnancies that may have a high-risk pregnancy, to the elderly or aging Tennessee resident who is needing to reimagine aging. So that's who we are. And thanks for having us today.
Thanks so much, Chanda. Wally, last but not least.
Hi, good afternoon, everyone. I'm Wally Ramirez, and I work for OLA of Eastern Long Island. We are a nonprofit organization that helps the mostly immigrant Latino community on the east end of Long Island, so meaning the 5 east end towns, which are Riverhead, Southold, Southampton, Shelter Island, and East Hampton. We are an organization that fights for and strongly believes in systemic change, education, arts, and health for our community. And we've just really excited to be here and present and learn from our peers on how to address this COVID fatigue that we're all struggling with.
Great. Thanks again to all of our wonderful panelists for their intros. And I want to go ahead and before we get into some audience questions, want to pose a first question for our panelists today around what COVID fatigue strategies have you all implemented, I guess, to address the COVID fatigue. We know that, as I mentioned in my intro talking points, that it could occur on multiple levels, that COVID fatigue could be within your organization as far as your staff. We know that you all do amazing work, but it's also challenging work too. So it could be on that front. But I acknowledge that COVID fatigue could also be occurring within your communities that you serve. In your interactions when it comes to vaccine education and outreach, you may be experiencing community members who express that they also have COVID fatigue. So want to put that back onto the panel to see what strategies have you all implemented to address this. And maybe we'll start off with Chanda. Would you like to go first? And then the other panelists are welcome to pop in as well.
Sure. So COVID fatigue is a very real challenge for us in terms of our organization, but also more importantly, in terms of our work in the community. And it was interesting because it wasn't us that said, you know, COVID fatigue is an issue. It's actually the population that we serve, our trusted messengers, who said to us, if we're going to plan another year of addressing vaccine equity, then we got to figure out a better way because people are sick of it. And quite frankly, we're sick of it. And if we don't have a different way to do this, we don't think that it's going to work another year. So we started talking about, so how do we talk about COVID and talk about improving these outcomes without talking about COVID? So we talked about, one of the things that we did was to say, you know, we held a long COVID town hall to talk about how sick of COVID we all are. And to say, like, if we had these types of resources in our community, maybe these conversations wouldn't be so hard. So to start thinking about how we could work collectively in the community to address some of those issues. Some of the things that we learned also talking to the communities that we serve is that maybe we don't want to hear all about COVID again, but we do want to know about opportunities to participate in other issues that are affecting health in our community. So one thing that we did was connected lunch and learns to community events so that people are not just coming to hear about COVID vaccines and where you can sign up, but they're also learning what the impact of extreme heat is in their neighborhood and what we can do in our community to begin to address that. So we've really been really creative along with members of the community to think about needs that they have and information that they want to learn about and information that they've heard from their peers that they're interested in learning about. So we've done that. We've also been really creative about connecting our work to current events and movies. Like one thing we do is have movie night and show a documentary called The Color of Care that was done by Oprah Winfrey and the Smithsonian Institute. So it's just a good way to create courageous conversations and build momentum and keep it going. So just a few things that we're doing.
I would like to chime in. For us here in central Wisconsin, we, along with the needs that we have seen with the community and trying to tackle that COVID-19 and the needs that our community has, and especially since we serve the Hispanic community, we created a nonprofit organization. So the H2N is a project, it's a community-based organization, but then we created a nonprofit. It's called HOLA, that stands for Healthy Opportunities for Latin Americans. Through HOLA, we have also implemented different activities that we have done like arts and music. And also we have been inviting people, like we have these conversations about COVID-19 and other social determinants of health, but also we do it in a fun way. Francisco, my colleague, he was leading with one of our community health workers. He's also a very passionate person for art, and he's an artist. So we started a project for a community mural, which it did not exist in this area here. If I don't know who is familiar with central Wisconsin, the Hispanic population and Hmong population are growing, and we are getting more like a diverse community from refugees. But we implemented this community mural with anyone, either if you are from Ukraine or you are a person, a local person from Wisconsin, whatever background you are, being Hispanic, Hmong, everyone was invited. And we also took those opportunities, not just to talk about the COVID-19 vaccine, but also just all the other needs that people may have that come up in conversations of doing this type of activities. We also, with the H2N program, we implemented other ways to have conversations with people. We don't just go to a place and bring a mobile clinic with the COVID-19 vaccine or other routine vaccination. We have been very innovative and creative. Like Chanda, she said, you have to be creative, right? So what other ways you can outreach your population and still feeling like you are not pushing for the COVID-19 vaccine, or is it still people is tired, right? Tired of hearing about the COVID-19 vaccine and following state or other organizations' directives that we have to follow, right? Like social distancing or getting the vaccine or all the risk. But we have also shifted into what other resources we can provide to people. So we are doing health resource first, where we can bring anything from what you need at home to be healthy in mind and healthy. You have a job, do you have shoes, do you have all the needs that you need to have met, do you have them already met? And then also approaching the arts, the music, and also we are educating people about the vaccine and telling people about the importance of this without preaching or lecturing, but also having those conversations in simple things with services that we have implemented, like we train our staff to do a stop the bleed training. So now we are going to places, workplaces, and we train other people how to stop the bleed so they can die from there and then have those conversations. It's more like in a natural way instead of being pushy. That's how we have implemented. Francisco, I don't know if you want to add anything else.
Yeah. So when thinking about vaccine, there is an inertia, there is an inaction from people to get vaccinated. And I'm going to talk specific about the Hispanic population here in central Wisconsin. And I would like to bring the perspective of a new family, a new arrival that is coming to the U.S. We know that we have a lot of people coming from Central America to the U.S. and the reality for them is completely different from someone that is established here in the U.S. and understand the way that you can get your vaccines, where to get them, how primary care works. So if we think about a Hispanic family of five, mom and dad, with three kids. Let's think that mom has a work permit that is undocumented. One child was born here in the US, another one was born in their home country, and another one is about to come. Um, the first interaction for Hispanic families with primary care is through the emergency room. If you go to the emergency room, you're not going to get access or education about vaccination. So, and also you don't get a referral sometime to go and see a primary care provider. And then the question is like, in this dynamic of families, where do they fit to get access to vaccination? So mom that maybe has a work permit, she qualifies for the marketplace. And if she qualifies for the marketplace, now she have insurance. So now it's a lot easier to get access to those vaccines. That and the child that was born in their home country, they don't have access to health insurance or Medicaid or marketplace. So the question is, where do they fit? So then FQAC clinics or free clinics kind of help provide access to primary care provider. And then the health departments provide free vaccination to kids. But we have to help them navigate those situations so they understand exactly where do they fit to be able to get a COVID booster or to be able to get just a regular vaccine. At the same time, with the new immigration population that is coming, they're under parole. And the meaning of that they're like in the process of in the process to regularize their immigration situation. So with that in mind, they need vaccines and they need vaccine from uh, here in the US that they have to be up to date in order for them to continue the immigration process. But if we go back to this family, mom with a work permit, dad undocumented, a child born in their home country, like where do we send them? How we connect them? So it's crucial to understand that the emergency room is not the place to get vaccinations. We have to help them understand primary care providers. We have to make sure that they understand that health departments can provide those vaccines too at a lower cost. And and by knowing those things, we can help them navigate and then we can help them be active to get those vaccines. So in the case of a new immigrant family that wants to obtain their residency, it's crucial that they have access to this vaccine. And sometimes it's not too much about that people is tired about hearing about vaccines in the case of the Hispanic family, as it is to know exactly where to get them at a price that is reasonable. Because the priorities of Hispanic families, number one, housing. Number two, food. Number three, take care of the family that sometimes is divided in two countries. Sometimes some part of the family is here in the US, but the other part of the family is back home. And they have to send money to sustain the family back home. So the priority is not in the vaccine. And like Mariana was saying, when we go and do like these clinics at different places, we're not trying to start the conversation with a vaccine. We're trying to start the conversation. It's like, What are your needs? Let's talk about it. What do you need? What is it important for you right now? How can we help you address like the lack of housing, let's say, or the lack of food? And then after you establish a relationship that is a trusted relationship, then we can start teaching them and we can start educating them. Then we can start talking about primary care. Then we can start talking about, are you working on your immigration status? You know that you need this vaccine, and if you need them, you can get them at a very low cost at the health department. And if not, we can connect you with a clinic that can provide a discount or can see you for free. So when you take some of the extra burden in the Hispanic community, then it's a lot easier to start talking about vaccination, to start talking about COVID boosters and all the other needs that they might have.
Thank you for that. And I'm already seeing a thread. I'll definitely hand it over to you, Wally, to share some of the strategies that your organization has used. And I'm already seeing this thread of addressing other needs from community members, that the conversation can't just focus on COVID or just on vaccination altogether, and that it needs to incorporate all of the other needs that your community members have and the issues that they face. So yeah, I'll hand it over to you, Wally, now to provide an overview of some of the strategies that you all have used.
Yeah, so I'm just going to piggyback basically off what everyone said. It's the same thing with us. We're taking now opportunities. We do licensing workshop and financial workshops, and we have a pachanga coming up where we have our vaccine ambassador attend all of these events. And, you know, it's just simple conversation. Oh, how are you? And then we start bringing in, we have a table with goodie bags. So goodie bags always attract people to come and talk to you, whether you're in a health fair, whether our vaccine ambassador even goes out to local businesses throughout the day, nail salons, barber shops, restaurants, with the permission of these owners, because we've been doing this for quite some time now. So we've already built those relationships. And we talk to the people that are sitting there on their lunch break. Hey, can I ask you a question? Are you interested in a goodie bag? This is what's in here. What about your health? Do you have health insurance? Do you know you're eligible for health insurance if XYZ? Have you gotten a COVID vaccine? And we also are doing a gift card giveaway where we're giving people $30 who have been vaccinated against COVID or flu this year. And even with that incentive, people just don't want to get vaccinated. So our other new approach that we've been doing, especially the guidelines, you know, they're remaining the same throughout all these years for the older community and people with comorbidities. So now we like focus a little bit on the group, and we let them know that we have, you know, this gift card giveaway and the importance of getting vaccinated, and do you know the new regulations that you should get a vaccine every 3 months and so forth. And we talk to them not as educate or people that are trying to force them to get a vaccine, just someone that cares about the community, that wants them to know the most up-to-date information, and we're here to help, whether it's to connect you to a vaccine. You want us to make the appointment for you? Sure. You need us to talk to your daughter who's been hesitant to let you take the vaccine for whatever reasons. Whatever we need to do and however we can support, that's kind of the role that we're playing now. So I agree with what everyone else said. We're at a different level now where you have to dive a little deeper, and it starts with that open conversation. And for us, we've been established for over 20 years, so the trust is already there. But just being creative and doing things a little differently than we were doing in the past to get the people motivated.
Thanks, Wally. That's another kind of theme that I see emerging, is this idea of creativity and innovation when it comes to addressing COVID fatigue and making sure that you have really effective communication with your community members. You know what they're facing outside of interactions with you all. So making sure you take that into account and craft really creative strategies to address that. I love that. And I know we'll dive even deeper into that a little bit later. I want to turn it over to the audience now. We'll do a couple of quick polls, make sure everybody's awake and engaging with us. So you should see that pop up on your screen shortly. One question is just, what region of the country is your organization located? We really just want to get a good grasp of where everybody is located. We have panelists here from, we mentioned New York, Wisconsin, we have Tennessee as well. So wondering where you all are coming from as well. Let's see. All right. Lots of folks from the South. Okay. I'll give folks another second to fill that out. Great. So you should be able to see the results. It looks like most of us are coming from the southern region at 40% of those that responded. We also have a good group of folks from the Northeast. And then it looks like Midwest and West are tied. So it's good to kind of know the lay of the land here and see where everybody is located as far as geography. Great. Next question that we have that you'll see pop up is going back to this idea of COVID fatigue and how it's impacted your work. So on a scale of 1 to 5, with 1 being not at all and 5 being very much, how much would you say that COVID fatigue has impacted your work? And again, 1 is not at all, 5 is very much. See some of that rolling in. Give that a second too. Great, so you should see the results there. As I expected, the reason why you're all here, that a lot of folks say that it's impacted your work very much. There's a lot of 4s and 5s here with a few 3s, 2s, and 1s as well. So I think that is even more of a reason that we should be gathered and really hearing more about these innovative solutions that you all are using on the ground to really share with each other about what's been working and maybe things that maybe haven't worked as much too. So you all are able to implement innovative solutions as well. Great. Thank you for participating in that. So I want to also pose some questions to the audience too. I've already asked our great panelists about some of the strategies they've been using to address COVID fatigue, but I'm also wondering about you all that have come into this space today. So what does COVID fatigue look like in your community? We can kind of start there. I know that it may look different for different folks, so you're welcome to drop information into the chat, as well as use the raise hand feature on Zoom to speak your thoughts as well. And the question is also posted in the chat if you need to reference it again. What does COVID fatigue look like in your community? Lachelle, yeah, go ahead. I see your hand.
Well, I'll say in our communities, I think people are just tired of hearing about COVID. In the beginning, we started out having some events strictly for COVID and COVID vaccinations, but somewhere along the line, we stopped having separate events for COVID. We just incorporated COVID into everything that we've done for, I don't know, the past 2 years. So we had COVID vaccines available at all of our regular events. We have COVID information. We've done a COVID survey at some of our events. So we've still found ways to keep it relevant, but relying less on the vaccine itself, especially in our area. Vaccines are harder to come by. So at this point, it's about information. We give information about vaccines. We talk about, and we still are promoting ways to prevent the spread.
And Lachelle, can you say a little bit about where you're coming from? I should have mentioned that. If you can say just the area or maybe your organization name.
The Northeast Ohio Black Health Coalition, and the organization is based in Cleveland. So we work throughout a large number of counties, 19 counties in Northeast Ohio. Not all 19 counties all the time. We have 3 counties where we're really focused: Mahoning, Cuyahoga, and Lorain, but we can be found in other areas as well. Thank you.
Great, and thank you for that input. I also see some thoughts coming through on the chat. reduction in all vaccines just across the board. So this not even being limited to the COVID vaccine, that's important to raise up. Another comment says people think COVID is over. People who are remaining updated with vaccinations before are no longer doing so. I imagine that that is pretty common across a lot of your communities as well. I love this comment about trying to look at it in a positive light. And I imagine this looking at it in a positive light is something that you also share with your community members too, that instead of lecturing, as someone mentioned earlier, that you really try to have your engagements be a positive engagement. Another comment says in the river region of Alabama, it's basically people being over getting multiple vaccines and not wanting to hear about what we try to share. Clinic participation numbers are low. And again, I imagine this is pretty common as well, that you've seen those numbers kind of dwindle off. I remember at the very beginning when the vaccines were first available, and how there was this urgency around it. And sometimes you couldn't even find a vaccine, right? Like you had to make your appointment and had to go through those hurdles. And then we saw this peak, and then it kind of has dropped off since then. So I appreciate you all sharing those thoughts, and again, hearing more about what you all have been doing to address this. I see some other comments in the chat as well. We'll welcome folks to come off mute if you'd like to voice over any comments, or if you haven't added anything to the chat but want to add on to what someone has shared, feel free to do so. Really appreciate all of these comments. Another question I'll pose here too, not only, thinking about what does COVID fatigue look like in your neighborhoods, in your communities, but also what are some of the strategies that you all have used? I think I see some of that in the chat as well. We heard our panelists talk a little bit about what they're doing. Anyone want to speak to that as well? Are you using some of the same strategies that you've heard already?
I would like to mention, for example, one of the things that we're doing that is very specific is that Wisconsin, we're in a very rural area. There is a lot of dairy farming. And with that, a lot of the workers on dairy farms are Hispanic. So we're not just trying to provide like training, but we know that diabetes, for example, is a chronic disease that is very present in the Hispanic community. We understand and we know the lack of insurance to access like A1C testing just to go and check your sugars. So we are doing A1C at the farms and blood pressure check. Then we do have a partnership with a free clinic that is called the WASA Free Clinic. And when we identify someone that has like a high level of sugars, then we can connect them right away with the WASA Free clinics to establish that primary care. And then they have the opportunity now to hear from the doctor that, oh, by the way, you have your vaccines. And then when it comes from a trusted source, it's a different way to communicate to the patient the importance of getting those vaccines, because now it's the doctor talking to you about it. And that communication, that relationship patient doctor is crucial also to have a trusted source of information. And we try to create those relationships, but in order for us to create that relationship, we are checking for diabetes. We're doing diabetes screening at the farms and also at any events that we're doing. The other thing that works tremendously for us is the use of community health workers. And by using community health workers that speak Hmong or Spanish, we're providing the message to them in their own language, and that break a barrier like right away. So that trusted messenger is a key point. It's a first point of contact between the consumer and our organization. And with that, then we can start talking about other services. And sometimes the need is in food. So we work with another organization and we get like pantries that then we deliver home, to their houses through community health workers. And then once we identify the need, then we know exactly in which direction we can move.
Yeah, and this incorporation of the social determinants of health is so important. That's what I hear you saying, Francisco, that, addressing things like food insecurity, and other issues is just really crucial to a lot of this work. I also hear you when it comes to like language capacity as well. If something isn't in someone's language, they won't really be able to engage with it, right? So making sure that those that you serve are able to engage in the language that serves them best is great. See some other comments coming in from the chat as well. Meeting people where they are. I love that. I feel like that's also a huge theme of all of the work that you do. I don't think it can really move forward if you're not meeting people where they are, right? Whether that's literally, right, with the mobile vaccine clinic, or like we were saying earlier about that language capacity, that if someone has those needs, being able to meet those needs. Brian, yeah.
Hey everybody. Yeah, I see Ava and I don't know who else is here from Lantern, but what they've been doing out here, we already have a program. It was like harm reduction and HIV education that where they engaged. We live in subsidized housing, and there was already a program where they reached out to basically employ us as community health workers. And then after COVID, we just kind of branched out. Now it's called Neighbor to Neighbor, and there's already one class has gone through college training and are employed full time. The next cohort is day after
I
tomorrow.
think this sounds like a great idea, Carrie. I could.
Oh, go ahead. Well, what I was going to say is I know I'm not going to phrase this right. I'm not sure about the language, but in one of the classes I heard how like personal health education is or should be like when you go in to see a doctor and they take your vital signs, that health, like the personal health education should be, considered a vital sign. Like everyone needs to learn everything. Like I said in the chat earlier, I don't think this is our last pandemic. Like here in New York, there's like a measles outbreak. There's always something, but I really feel we need to stay ready and stay vigilant.
Thank you, Brian. Really appreciate that, especially the comment you made around kind of having this like level foundation for everybody, where education is just almost like woven in to primary care and to other conversations, that everybody is kind of starting off at the same place and gets the same information. I really like that idea. Yeah, health literacy as a vital sign. Absolutely. I also want to pose this question first to our panelists and then see what our audience thinks as well around this idea of integrating community voices into your strategic planning when it comes to addressing COVID fatigue. What has that looks like for you all? How has your organization integrated those community voices into your planning?
I'll start. What we've done is our community members are an integrative part of the work that we do. And it was them who said, if we're going to plan another year of improving vaccine numbers and decreasing COVID-19 infections in our neighborhood, it won't be because we do it another year like this. And we talked about, well, one of the things that they really felt that was important is to address some of the messaging around, like, we're sick of COVID-19. And the language instead was, we're neighbors, we're family, we love each other. So as a responsible member and of this neighborhood, we're gonna look out for each other. We have a responsibility to look out for each other. So like one of the things that we did in February was to do a postcard campaign for Valentine's Day. And it was just reminding folks, love your neighbor, love yourself, love your health, get vaccinated. But it was just a reminder that folks in the community are accountable to one another, that we love one another, and that we have a responsibility to keep each other safe. So I think that has been something that's been really helpful to our work.
I can go next. For us, we have implemented different things. One of those is being inclusive. Being inclusive, again, as we serve Hispanic and Hmong communities, we can have similarities, but we also have specific challenges in our own communities. And also we know that we all cope in different ways. So understanding those cultural aspects through the work that we do, that's how we've been doing more strategic. We also do networking and partnering with multiple organizations. So if we look back in March 2020, when the H2N project was created, we have 3 partners. So after 4 years, we have quadrupled that. We have over 20 community organizations that we partner with. And I think this is all across, like everyone in here, like from health organizations, like free clinics, federally qualified health centers, from health departments, from faith-based organizations, school, anyone in the community basically that wants to be on board with us and we can do something for our community. That's been a strategic plan that we have developed, and it has worked very well in the past 2 years. We also have fun events. So it's not just like, oh, there is a table there either for an educational table, like about vaccination or other topics, but we also have fun. When we work, we do mainstream events and cultural events that they can go from the Pride event to having Dia de los Muertos, which is Day of the Dead celebration, the same as the cultural aspects of the Hmong community. They do celebrate the Hmong New Year, or they have a Hmong week where we are in those mainstream events. If there is a concert and we know that our communities will be there, we attend those mainstream events as well and have fun. It's not just like everything it has to do again about just graphics or showing how the importance of the vaccine is, but also connecting. And again, I think one of the main things is connecting through art, music, and not just having those social determinants of health being met, but also making feel our communities welcome, making feel our communities that they are part of the community, that they are not outsiders, and especially those newcomers that are settling here in central Wisconsin. And everyone who is already in this community, making them and hearing and seeing us that we also are part of the community.
Just to add to Mariana's, when we started working with COVID, it was because we didn't have a representation that can help us get access to the vaccines. To be able to gain a seat at the table with all the organizations and local counties was crucial to bring the needs of the changing communities in rural areas, in small urban cities, and to bring the needs like, hey, and now your county has a larger number of Hispanic, a larger number of Hmong communities. These are some of the needs that our community health workers are identifying. When we think about, like Mariana was saying, incorporate arts and letters into the community, it's creating community, something that it wasn't in our area because the dynamic of the demographics are changing now, and we have a larger number of Hispanic population, a larger number of Hmong community, and new refugees coming to the area. from Afghanistan. So how can we create a more welcoming community? And we believe that through art, through something as simple as a mural that represent a community, can provide a positive message to the community. By being part of the strategic planning conversation meetings with the counties around us, that also is being crucial to bring up the voices and needs of communities.
Thank you for all of these great strategies and how you've been able to tap more into your communities and really take into account, their thoughts, their feelings to better inform some of your approaches. So you're not just, creating them from your mind or from your organization, but you're really using those voices to really refine what you're doing and continue to improve what you're doing. Really appreciate that. I want to end here on one note about if there's one piece of advice. I'll go to our panelists and then see if there's maybe one or two people from the audience that would like to share. If there's one piece of advice that you would want to give to an organization that is just really starting to put pen to paper when it comes to concrete strategies in addressing COVID fatigue, what would you tell them? What would be like your 1 to 2 statement piece of advice that you would give to this organization?
I can start with that. I would say don't be afraid to fail in the outreach or the communications that you are doing, or the way that you're doing, or everything that you are even hearing in here or from other different organizations. Just try. And if that doesn't work, don't be afraid and change it, because there are ways that every community, and again, has different cultural aspects. And if you want to be inclusive, what works for the Hispanic community, the way that we can word an event, and you want to be inclusive, it might not be the same words that you want to use for the same event with a different community. I hope that makes sense, but I can explain more.
No, it makes sense. Thank you, Mariana. Wally, I think you had come off mute initially. Did you want to share your really quick, what would be your advice for these orgs?
Yeah, I would just say really quick, just be genuine, be a human, talk to your community the way you would talk to your grandma, to your father. That goes a long way. And I don't think our job is to convince people to try and get a vaccine, but education on why, even though the pandemic is gone and it's harder to get a vaccine, why it's still important. I think that is the number one takeaway that's been really working for us throughout all these years is our approach, how we talk to people, and the relationships that we've built. And we even have people that got vaccinated with us in 2020 all the way in Montauk, and they still call us 3.5 years later to see if we're doing another pod because they enjoyed the experience that we brought to them. So I think that's the number one key. Talk to people like they're your family, and know that our job isn't to convince people to get a vaccine, but to educate them to make the best choice for themselves and their families.
Right. And I think I'll add to that, is that in our communities, I think we should look for opportunities to intentionally disrupt the public narrative. So, and we have opportunities like that when things are happening in the community. If there's a hospital closure, or one thing that we did was connected COVID-19 to the triple-demic, and how, we're going to insert our information into this narrative here. This is a triple-demic happening. This is why our neighbors need to stick together now, like more than ever before. So, I think that we have opportunities to work alongside our community partners to inform the public narrative, and then to insert ourselves in the middle of it to intentionally create competition, conversations, and reasons for people to keep positive narratives happening.
Thank you, Chanda. Francisco, I'll give you the last word here. What's your quick piece of advice that you would give orgs that are just starting off on this path?
That's a hard one. we have to kind of wake up that inactivity, that inertia from COVID fatigue, and everybody's need is completely different. But once you identify them, provide a service that's going to be meaningful to your to your own community, and that's going to open the door to establish that trusted messenger that's going to help you start the conversation. And it's exactly like Wally was saying, we want to educate you, we want to be here for you, we want to be able to provide access to it. We're not here to push you for it. And if you have questions, we can help you find the right person that can have an honest conversation with you. And that, I think, is going to be crucial to continue providing the access and to continue having the conversation about COVID and all vaccines. And we understand that time changes and life gets busy, but the moment that we can have an honest conversation with the consumers, with the families, with the communities, is the moment that we can start a relationship.
Thank you. What a great way to kind of tie a bow on all of this. Want to say a really, really special thank you to all of our panelists today. One, for your time and just lending all of your great knowledge to this space today to talk more about what COVID fatigue has looked like for you and what are the innovative solutions that you've used. Also want to say thank you all in the audience for participating with us today. I think I emphasized at the beginning that the success of this event really depended on you all to engage with us and talk with us and to really share with one another. So I appreciate you all doing that. You all should shortly see a satisfaction poll for today's event. We really appreciate the feedback that you give us to inform future events that we host through the program. So please fill that out before you exit today's program. In the chat, I also posted some upcoming PAVE events. We have one coming up on April 2nd from 3 to 4 Eastern. It's the third training in a series around social media. It'll be focused on building trust and influence online. That link is in the chat, as well as an office hours session on April 3rd. There are 30-minute slots that you can sign up for, and that one will be around social media analytics and measurement. So if you have questions that you want to bring, please fill out that registration form as well. And last but not least, we also are planning an event on April 10th called Reaching Adults Without Insurance Coverage for COVID-19 Vaccines, Insights for Supporting the Bridge Access Program, which I feel a lot of you here will likely find very useful. So please be on the lookout for the registration link for that, as well as the link that will include the time. We're still trying to figure that part out, but we really look forward to hosting that and providing you that great information. So thank you all again today for your time. Really appreciate it. And I hope you enjoy the rest of your day and the rest of your week. Take care, everyone.
Thank you.